Hi, so just back with another update on COVID-19 in Bristol and what we're doing to keep everyone as safe as possible. You'll know it's been a challenging time for Bristol. As of the 12th of November, our infection rate was 447 cases per 100,000 people. That's 2,073 cases in the last 7 days alone. This is the challenge for us. The England average of 100,000 prevalence amongst the 100,000 cases is 134. Oldham is 248, Blackburn and Darwen 736, Baines 229, South Gloucestershire 330. So you can see that in the incidence of COVID, we are up there and facing a challenge. The regional R number remains estimated within a range of 1.2 to 1.4. More data is going to come out this evening, that's Friday evening, and we will update our website accordingly. This is difficult, but we do ask you to remember the guidance and the rules: hands, face, and space. Stay at home as much as you can, limit your social interaction, self-isolate if you are asked to or have symptoms. The virus spreads person to person through droplets and aerosols. So understanding that you can manage your behavior to minimize the risk you expose yourself to, and by extension, the risk people who come into contact with you are exposed to. Please look after each other. And look after yourself. A 24-hour, 7-day-a-week mental health support line is available on 0800 0126 549, 0800 0126 549. And if you need support for anything, you can call the hashtag #WeAreBristol helpline on 0800 694 0184, 0800 694 0184. That could be you are struggling getting hold of food or medical supplies. We will be able to put you in touch with people who can offer you that support. So please do reach out to us. We do need to face up to this together, and no one should be shy about coming forward, sharing their needs. This week, Bristol has been named one of the 67 areas to receive the rapid COVID-19 tests. So we're going to receive a batch of 10,000 tests as part of this new pilot scheme. The devices are called antigen lateral flow tests, and they don't require a laboratory to process them, which is one of the things that makes them so quick. Now, this is not the same system that's recently been announced in Liverpool. Liverpool rolled out citywide testing with the aim to test everyone, whether they had symptoms or not. Our Director of Public Health is working closely with Public Health England, South West, and the local NHS partners to draw up a detailed plan for our testing regime. We're going to look at how these tests can be delivered to targeted groups and to better understand the spread of the viruses. And this will help support and expand our local testing capacities. More details are going to be shared once the plans are agreed. And if you want more information about the latest guidance, visit the bristol.gov.uk/coronavirus website. Homelessness has been an issue. It was an issue in the first lockdown, and it's becoming an issue again. At the moment, we estimate about 75 people on the streets. We know that the viruses, they are particularly vulnerable to the virus and also at risk of passing it on. So since the everyone in call, that's when we took people off the streets last lockdown, we've provided 1,181 accommodation placements. 372 people remain in accommodation. 418 have successfully moved on. So when it's done right and the services and the support comes in, we can support people to really open up a new chapter in their lives. And we hope to continue doing that with adequate government support that we're going to be pressing for. We're going to increase emergency accommodation at this time, particularly for those with higher support needs. That means increased access to rooms in shared houses and repurposing existing accommodation. We have 3 sites currently operating as supported housing. We have a bid for a share of the government funding of 10 million to local authorities through the Protect programme, that we will then hopefully take that money and again invest in supporting rough sleepers and people who are fallen into homelessness. So lots going on. Please take care of yourself. We're going to do our best for you. But remember, hands, face, and space. Limit your physical interactions with other people.